Okay, entonces, ¿qué te hicimos? So what did we do?
Me hicieron tummy tuck,
I had a tummy tuck,
lipo de brazos,
liposucción de los brazos,
lipo de
liposuction to the arms,
BBL
y una en a BBL, y una transferencia de grasa a las pompis.
y a las caderas.
Y a las caderas. ¿Y hace cuánto fue eso? And to the hips.
Fue el jueves pasado.
So it was on Thursday, so...
12 días, 12.
Huh?
Fue el jueves 12.
Oh, so on the 12th.
Sí.
So today is the 18th? Today's the 18th, right? Okay, so 6 days. Today's the 19th? The 19th, yeah, okay. So 7 days, yeah, exactly a week ago. Okay. ¿Y cómo fue tu experiencia? How was your experience?
Oh, mi experiencia fue nada dolor.
Oh, my experience was, wow, no pain.
Solo la espalda nada más por andar inclinada, pero dolor.
I had a little bit discomfort on my back because I was leaning forward, but... Y sangrado, morado. No bruising.
Nada, morado,
no
pompis, nada.
Bruising, no bleeding. No bruises on my buttocks either. Sí. Wow.
Me habían dicho que la lipo de brazo y la lipo de piernas dolía muchísimo.
They told me that the liposuction to the arms and...
Pero no me ha dolido como yo esperaba.
And to the inner thighs. Oh, we did the inner thighs too, right? Okay. They told me that it hurt a lot, but no, it didn't hurt me at all. Wow. ¿Y tú tuviste otra cirugía por otro doctor, una cirugía cosmética? You had another cosmetic surgery by another doctor. ¿Y cómo comparas tu experiencia? ¿Cómo comparas tu experiencia operada conmigo y la cirugía que tuviste con el otro doctor?
Oh, mucho cambio.
Big change.
Mucho dolor.
It was a lot of pain.
Fue mucho morado.
And was a lot of bruising.
Fui a la sala de emergencia.
I had to go to the emergency room.
Sí,
8 days later.
Sí, a los 8 días fui a emergencia.
8 days later, went to the emergency room.
Sí.
Why? ¿Por qué?
Porque andaba las piernas. No me hicieron lipo de piernas y andaba morada hasta
They didn't do liposuction to the legs, but the bruising extended all the way down to my legs.
Sí, entonces sí fue muy dolorosa
and
la
it was
lipo que me hicieron.
Extremely painful, the liposuction that I had done. ¿Y hace cuánto fue eso?
Fue 2 años.
So it was 2 years ago that she had the liposuction. Y además de eso, el resultado de, por ejemplo, el abdomen. So on top of that, what about the results on your abdomen?
Bueno, como fue lipo nada más.
Since it was liposuction only,
BBL, pero
and the fat transfer to the buttocks,
se me fue la grasa aparte.
The fat graft to the buttocks disappeared.
Sí, entonces
y la barriga and the belly.
Me quedó demasiado.
And the belly, it was
me quedó un
horrible.
punto en el ombligo.
It was very, very ugly. ¿Qué pasó en el ombligo?
Me quedó como un bulto alto.
I had like a mass above my umbilicus. I thought it was a hernia. Wow. So yeah, this is the case I was talking to you about. That precisely, that's why we do a tummy tuck first, and then we address any excess fat. So we want to leave her nice and tight. In her case, she had some severe irregularities, and she still has a little bit of it left over that we couldn't really correct. But she looks a lot better, and she's very, very happy. And notice the incision, how beautiful this is. She's only a week out. I'm going to give you a close-up. Look how natural that belly button looks. Not a single bruise. And what I would have done with her is I would have done the tummy tuck first and then do a high definition liposculpture and really draw out those abdominal wall muscles in a feminine way. So the result would have been a lot better, but she's very happy because we corrected all her irregularities, the excess skin, or most of her irregularities anyways. But I'm telling you, when I went into just to put the anesthesia, my cannula almost bent, and it was like a rock in there. It had so much scar tissue. I believe that scar tissue is the result of bleeding. And to a certain extent, I don't know if she had an energy device or not, but it's usually the amount of bleeding, because we do these cases and we don't have that extensive scarring, but I do see it frequently from other surgeons. So I believe it is the result of bleeding. The bleeding, the blood, when it's outside the blood vessels, is irritating to the tissues and it creates internal scarring and irregularities. In addition to that, she didn't have tummy tuck to begin with. But liposuction was done, and it's not even a good idea economically speaking, because she had to pay for the lower abdomen liposuction, which we threw away. We basically cut it out. So it doesn't even make any sense economically. So that's my opinion. Maybe some doctors will differ from me, but this is a clear example of why it's best to do a tummy tuck first. If the patient needs a tummy tuck, do it first, and then wait 6 months later and do an extended abdominoplasty with no restrictions. Thank you so very much for your testimony. Thank you.
Thank you.
Okay, so look at her buttocks. So this is just a liposuction from just the inner thighs and the arms, and a little bit of the lower abdomen. She didn't have much fat. We didn't do her back at all, but notice the complete absence of bleeding or bruising, and she's just a week out, and she looks good, right? And she didn't have much fat to put in there, but she's happy. ¿Estás contenta?
Muy contenta.
Mira qué bonita se le ven las pompis solamente después de una semana, y no tenía mucha grasa, muy poquitito aquí en los brazos y muy poquitito aquí y un poquitito de la barriga, porque ya le habían operado, ya le habían hecho la lipo, o sea que no había mucha cosa. She already had lipo, so she had minimal fat to graft, but I still was able to do it, and she looks good, she's happy, and guess what? She's gonna keep this fat graft. Okay, almost 100%. Why? Because what we put in there is pure fat. That we got it out clear and beautiful and yellow, and it went back in clear, beautiful, yellow, bloodless and oil-less. Because when there is blood in there, when there is oil in there, which is the result of aggressive liposuction at full speed with very high-powered machines at high pressure, what happens, and they also inject it fast at high pressure, not only is that risky to inject that high pressure into the buttocks, but what happens is that the body rejects that oil. It rejects that blood. And obviously, you know, if, like, let's say 30% or 50% or whatever you're putting in there is blood, well, that's not fat. Obviously, that's going to be resolved, right? But in addition to that, it can create the famous blowout fractures where you have like a light bulb sticking out here because it's like a cyst. It's like a